Lobotomy, also known as a prefrontal lobotomy, is a surgical procedure that involves severing or damaging connections to the prefrontal cortex of the brain. It was developed in the early 20th century as a treatment for various psychiatric conditions, including severe depression, schizophrenia, and anxiety disorders. While lobotomy was initially hailed as a groundbreaking treatment and was even awarded a Nobel Prize in 1949, its use and effectiveness have been highly controversial. The procedure was based on the theory that by damaging the prefrontal cortex, the more primitive areas of the brain would gain dominance and alleviate symptoms. However, the outcomes of lobotomy were highly variable, and many patients experienced severe side effects and a significant decline in cognitive and emotional functioning. Common side effects included personality changes, apathy, impulsivity, cognitive impairment, and in some cases, even death. Over time, advancements in psychiatric medications and therapies rendered lobotomy largely obsolete. The introduction of antipsychotic medications in the 1950s and the development of more targeted and less invasive treatments diminished the use of lobotomy. By the late 20th century, the procedure was almost entirely abandoned in most countries. Today, lobotomy is generally considered an outdated and highly controversial treatment. It is no longer considered an effective or ethical approach for treating psychiatric conditions. Modern psychiatry focuses on evidence-based treatments, such as medications, psychotherapy, and other non-invasive interventions, which have shown more reliable and targeted benefits for patients.